Wisconsin's Department of Health Services has updated its policy for covering gender-affirming care for dates of service on or after December 31st, 2022. The policy expands coverage for gender-affirming care while also modernizing some of its terminology. Let's take a quick look at where we've been. It was in 1996 that Wisconsin's Medicaid regulations were updated to specifically exclude coverage for services that were at that time called associated with transsexual surgery. That was challenged in federal court as being discriminatory, and in 2019, a federal judge ordered Medicaid to stop enforcing this exclusion. Shortly thereafter, Forward Health created a policy for coverage of transgender services. And while that policy had updated coverage criteria, it was vague. That's where this new policy is helpful. It has been updated with more detail to explicitly cover a wide array of gender-affirming care. The new policy explicitly allows coverage for services like voice surgery, body contouring, and in fact, even more services. That's one of the big enhancements of the new policy. It's a longer list of covered services, but it's not exhaustive. Other enhancements of the new policy is that requested treatment must be appropriate for the patient's individual needs. It applies to patients with a wider variety of identities. And like we said, and as you can already tell, they've updated their language. Now, to get the treatment, here are some of the criteria. Getting gender-affirming treatment requires a prior authorization. The individual must have a gender incongruence-related diagnosis. There must be a referral from a qualified healthcare professional, and it must show that the requested treatment is appropriate and any risks have been considered. Now, if that prior authorization is denied, there are Medicaid fair hearing appeal rights. You can read that policy coming out of the state of Wisconsin. We link to it in the description below.